Hello again, it's Mark Middleton from Growing Boulder, and it does feel like we're starting to make some progress, but obviously we are not there yet. This pandemic, this national emergency, this nightmare for all of us continues, and I think we've all learned throughout this process that it is important to stay informed and stay connected. And toward that end, Growing Boulder and our good friends from Florida Blue Medicare have arranged a bit of a live telemedicine hookup, if you will, today, because we're going to check in with one of the nation's top epidemiologists. Dr. Shamarial Roberson is the Deputy Secretary of Health at the Florida Department of Health. When she's not leading the effort to combat COVID-19. Dr. Roberson is an expert on prevention and intervention of chronic disease. She's a highly respected researcher with a special interest in reducing health inequities in chronic disease. And joining us live now from the Florida State Emergency Operations Center in Tallahassee is Dr. Shamarial Roberson. Doctor, how are you doing today?
I am doing well. It's so nice to be on the call. I look forward to our conversations about COVID-19. I'm happy to be here. Thank you for the opportunity.
Thank you for what you're going to tell us. But let me say right off the bat, thank you for your energy and for your smile. I think it's so important that the people that are, leading policy and making decisions remain optimistic. And I know that about you. Obviously, economically, Florida is suffering from one end of the state to the other. But how are we doing from an overall health standpoint? Are we flattening the curve?
Yes, it is important to note that the cases for COVID-19 has been stable. We're looking at an average of about 1,000 cases per day.
And given that Florida, as we all know, is not just domestically, but internationally, one of the world's biggest travel destinations. And considering that we have such a large number of seniors living in the state, one might think that we would be doing worse than we are. But that said, yesterday we had the second highest number of fatalities, 60 in a single day. Are you concerned about that, or are we moving in the right direction and that was a bit of an anomaly?
Yeah, so in terms of the numbers, we're staying very vigilant with watching testing numbers, with watching cases, with watching deaths. It is important to note that we do understand as age increase, so does the chance of having vulnerable health conditions such as diabetes and heart disease. In Florida, we have a large older population, so we have remained vigilant, working with community-based partners, working with private partners, working with the healthcare sector to ensure that those vulnerable individuals have precautions in place to prevent COVID-19. So what I'll say about the numbers on yesterday, we are continuing to enhance our efforts to ensure that we keep the curve flattened and ultimately decrease the curve around COVID-19 cases and working to decrease deaths associated with COVID-19.
I think we're all learning on a daily basis that testing is a big part of this. And we've, I think, had just under 29,000 confirmed cases in the state of Florida. We've tested about 290,000. Are you pleased with the numbers that we're testing, and do we need to do more before we open up the state?
So in terms of testing, let's talk about that a little bit. So when this first started, and we started with testing, the Centers for Disease Control and Prevention, they were doing testing, and then that was testing of symptomatic individuals or individuals with symptoms who have been in contact with someone else with COVID-19. Since that time period, our public health laboratories started testing for COVID-19, and that is in Jacksonville, Miami, and Tampa. And what that means is they don't exactly collect the specimens in the lab. They just receive the specimen collection kits, and they run the actual test to determine if someone is positive or negative for COVID-19. After that, commercial laboratory testing came on board. So what I can say is I'm very proud of the enhanced testing capabilities in the state of Florida. And we've done a lot of testing in a short amount of time. And we are very happy to announce that we are expanding testing sites across Florida, community-based testing site, in-home testing options, other testing sites all over the states, working with hospital systems, working in our county health departments, working with our community partners. So what I will say is I'm proud of our enhanced testing capabilities, and I look forward to expanding those options.
As an epidemiologist, I know this has got to be something that you didn't want to foresee, but you obviously had to acknowledge the possibility. You're a Florida girl, if you were a Tallahassee girl. You have degrees from FAMU and also FSU. You're now making policy decisions in an important governmental job in Tallahassee. This has got to be an amazing challenge. I know you're putting in very long hours, but do you feel like you're fortunate to be in that position, to be able to use your education to help those who live with you in the state?
Absolutely. I have been a Florida resident my entire life, and I feel very fortunate, and I'm passionate about public health, and I'm happy to serve. So although we are putting in long hours, I'm available 24 hours a day, 7 days a week. I'm a full-time deputy secretary for health, but I feel fortunate to understand the landscape of Florida, and I'm fortunate to serve. And I feel like my background, my education, everything have aligned to prepare me for the moment in time, and I'm prepared to continue to fight against COVID-19.
Well, we're fortunate to have you there. And one of your areas of expertise and considerable research has to do with health inequities, the differences in health status and the distribution of health resources over different population groups. And COVID-19 seems to have exposed some health inequities, especially in its impact on African Americans. And you're a thought leader, you're a policymaker. What can we do as a society to address these important issues? Because I don't think anybody out there can argue that it is anything but unfair.
So in terms of health inequities and disparities, what we do know with many minority communities, including the Black community, is that there are disparities with chronic conditions. What we know about this new and emerging virus is that it is particularly associated with worse outcomes with chronic conditions. And we know that this population suffer from chronic conditions. So what we are recommending, as we have in the past, is the management of chronic diseases such as diabetes, adhering to the medication that's prescribed by a healthcare provider, those hypertension drugs, making sure that people who have these drugs maintain the management of these chronic conditions. And if conditions are changing, we want to urge individuals to seek provider care if conditions worsen or if symptoms present, such as symptoms for stroke or heart attack. So I think with this community, this is an opportunity to remain vigilant on the management of chronic disease, to work with community-based partners, faith-based organizations to get the message out about the prevention of COVID-19. The best way to prevent the spread of this is to prevent the exposure to the virus. So what I will say for the population is this is an opportunity to continue to remain vigilant and fight against chronic conditions, as well as protect that population and other populations from the outcomes of COVID-19, the poor outcomes.
There you go. I love this conversation. And folks, we're talking with Dr. Shamarial Roberson, who is the Deputy Secretary of Health at the Florida Department of Health. No question, we're dealing with a pandemic right now, but I think you nailed it. The epidemic, if you will, of our time is preventable chronic illness. 80 cents of every healthcare dollar goes to treat stuff that we have the ability to prevent ourselves if we make positive lifestyle modifications. So thank you for that message. I really appreciate it. As an epidemiologist, are you surprised by COVID-19? We're learning more about it each and every day. And as you learn more, are you just a little more comfortable with what you learn or a little more worried? Because it seems like this is a virus that has an ability to mutate and a very strong desire, if you will, to continue to thrive. It's now in pets, I understand.
So as we learn more about this virus each and every day, we're taking what we learn. We're working with the Centers for Disease Control and Prevention. We're working with our county health departments in Florida. We have an integrated public health system, and we have 67 county health departments, and we have a state health office. So with our integrated public health system, it places us in a very unique position to respond to this pandemic. So as the days grow, I feel encouraged that we learn more and more about the virus. I feel encouraged that we're expanding tests. I feel encouraged that we will continue to expand our communication efforts to the public so that they are informed even more about this. We're transparent in our dashboard so that community partners can make decisions based on data. I feel encouraged that, we will continue to learn more as additional testing capabilities are expanded, such as antibody tests. So as we move forward day by day, I feel encouraged that we're learning more about the virus so that we can slow the spread.
We're talking to Dr. Roberson, who, as you can see, is sitting in the Emergency Operations Center for the state of Florida. What's the feeling there? Are you guys just kind of seeing what happens day to day before any decisions are made about opening up this state? Do you have a sense that you can share with us about how the state will open up, whether it's in pockets or everything at one time? What's the very latest?
So in terms of the feeling at the Emergency Operations Center, I feel like it's a wonderful place for collaboration. We're working across agencies. We're working here with the Agency for Healthcare Administration, for example. We're working with the Department of Children and Families. We're working with the Emergency Operations Center here with the Department of Emergency Management to ensure that we have a collaborative approach. So I'm very happy that we're all in the room together, making sure that we're making database decisions, making sure that we're here collaborating on this effort together. And we've been here for a long time, 40 something plus days. We've been here working on this together. So it is a good opportunity in terms of us advising. We're using public health data. We're making it available so that the individuals who are determining different steps in this process will have the latest data. We will be able to inform based on public health practices. So we're working closely with everyone involved to provide the data, to provide the public health practices, to ensure that we make good decisions based on the data.
One of the questions we get asked a good bit, Dr. Roberson, has to do with medication. And I know I don't think you're an MD, so forgive me if this is something you don't want to answer, but are there any medications that people shouldn't be taking right now out of fear that it might exacerbate any potential complications from COVID?
So what I will say about medications, it is very important that individuals consult their healthcare provider when it comes down to medications, any type of medication for COVID-19 or any other illness. It is important that that decision is made in consultation with their healthcare provider.
One thing that we were talking about earlier is that, hopefully this will all be gone at some point, but I think something that will remain is we will wash our hands more. We'll be more aware of things that are around us. We'll develop better hygiene. We'll disinfect around our homes more. Might that be the rainbow at the end of this storm? At some point, we actually reduce the incidence of flu and other contagious diseases because we have modified our lifestyle?
Absolutely. That is one of the things that we will gain from this response is better sanitation practices, better prevention against respiratory illnesses such as flu. So that is something that we will likely gain from this response, and it's something that is greatly welcome. But that is a good thing that will result out of this.
And finally, one more thing about lifestyle, and we'll let you go. Obviously, the people who are immunocompromised seem to be most susceptible to this, and some forms of immunocompromisation, probably not the right word, we can't avoid, like chemo or an organ transplant. But smoking, and correct me if I'm wrong, smoking is something that will compromise your immune system. And that is something that every one of us does have a great deal of control over. Is that part of what you encourage people to do? Stop smoking if they do?
Yes. So we have a Bureau of Tobacco-Free Florida here at the Florida Department of Health. And on our website, you can click on the link and there are ways to quit, and there are services that are available to quit for free. So we have a bureau that is dedicated to that. We do understand that smoking is related to the risk of chronic diseases. So we are promoting our continued campaigns for a tobacco-free Florida.
That's a good point to put up a graphic, if we can, that talks about your website, floridahealth.gov. The Department of Health, the Florida Department of Health, and also Florida Blue have provided us a very long list of resources and helplines that every citizen in the state should know about and should have nearby. a great place to start. And also, we will put a link to that page on our website in case you've missed it. That's growingboulder.com/COVID, where Growing Boulder and Florida Blue Medicare are partnering to help you stay informed and stay connected. Dr. Roberson, thank you so much for your time. Thank you for what you're doing. I know you're so busy. You're kind of quarantined there among your peers. So I don't know if enough people have an opportunity to thank you for your dedication and all you're doing, but we do greatly appreciate it.
Thank you, sir. And thank you for the opportunity to speak to the people of Florida. I just want to remind people, as we fight against COVID-19, to continue to adhere to guidance, continue to wash your hands for at least 20 seconds with soap, continue to remain social distancing when in public, stay at least 6 feet apart. Remember, if soap and water isn't available, use an alcohol-based hand sanitizer that's at least 60% based in alcohol. Continue to wear masks when in public. That is recommended by CDC. So make sure that we're adhering to these things to keep public health safe. Public health is everybody's priority. Everybody can play a part in this. So if we work together, we can stop and slow the spread of COVID-19.
Well, thank you for that. We really appreciate it. And finally, a Growing Boulder note, if I may. I admire people like you who will step up in front of a live camera and talk to a guy they have never met, because let's face it, a lot of people are afraid it can be a risk. But as a public service, you're doing a good deal, and it's not easy to do what you just did. So thank you so much for that. And folks, to all of you out there, thanks for tuning in, and we'll see you again tomorrow. Have a good day.